Hello, welcome to the program. I'm David Spears, host of Insiders, filling in for Hamish McDonald. Great to be with you live from Melbourne. Joining me on the panel tonight, infectious diseases expert Michelle Ananda-Rajah, Director of Health and Aged Care at the Grattan Institute, Stephen Duckett, National Affairs columnist at the Australian Financial Review, Jennifer Hewett, in Brisbane, the Queensland Premier, Annastacia, Palaszczuk, and in Sydney, Liberal member for Mackellar, Jason Falinski. Please make them all feel welcome.
I'm a 31-year-old and I'm weighing the personal benefits of whether I should take the AstraZeneca vaccine. While it's clear that, for me, the medical benefits tell me I should wait for Pfizer, I'm willing to take on the little bit of risk if it means that Australia can open up faster, we can open our borders, or I can protect other Australians if the virus gets in. My question to the panel is, how do I make an educated decision on how my vaccination contributes to the rest of Australia without clear information on vaccine rollout targets?
Well, thanks, Tristan. And Premier Palaszczuk, I might put that to you first. What should Tristan do?
Well, I'd say to Tristan to go and speak to your doctor, because your doctor will give you up-to-date information depending on your personal conditions, your personal medical history. But what's very clear is that there are concerns about young people under the age of 40 receiving the AstraZeneca. This has been in ATAGI advice, and our Chief Health Officer here has advised our young people under 40 in Queensland to wait until the Pfizer vaccine comes. Now, we want everyone to get vaccinated. We are pro-vax, but we know that the risks of blood clotting is actually higher the younger you are. So that's information that you have to weigh up when you go and speak to your medical practitioner.
Just to be clear, though, in your state, Premier, if you're under 40, can you get AstraZeneca at all, or is it simply advised that you don't?
Well, in Queensland, the information that came out of Scott Morrison the other night was that he was opening it up for under 40s. That was not a decision that was taken at National Cabinet. I was surprised, as were other premiers, that this announcement was made without any consultation. We had the AMA out the following day, bemused about this decision. I'm yet to hear any federal cabinet minister say that this was a decision that the federal cabinet took. And I think we need to be very cautious and look very closely at the medical advice. OK,
but it's not a ban on under 40s getting AstraZeneca.
It's not a ban, but I think everyone needs to be very clear. Now, this is the way I look at it. I have about 1.2 million people aged 20 to 40 in my state. These are not statistics. These are real people. These are people's sons and daughters, brothers and sisters, uncles and aunts. And I could not live with myself if the truth was not out there. And once again, I say to everyone, go and talk to your doctor, but look very closely, because our advice is to wait until you can get Pfizer.
Michelle, if Tristan is aware of the risks of AstraZeneca, as he said, but still wants to do his bit so that Australia can open up faster, should he be allowed to take it? What do you think?
So, Tristan, my advice is to follow the health advice, OK? And take your advice from your doctor and not from politicians. The key here is that there's a lot to actually unpack with your question. So let's just go through the stats. In young people, say 20 to 40 or 20 to 60 even, the risk of TTS is not really clear. And that's mainly because the countries that rolled this out actually suspended the use of AstraZeneca when they started to see the signal in young people. So we estimate that the risk may be somewhere in the order of 1 in 20,000 to 1 in 40,000, okay, based on data from Norway and also ATAGI's own data. Now, if I said that to a patient in front of me who was 20 years old, they would wave it away and they would say, Doc, you're overreacting, right? Here's the thing, when you start to vaccinate at high volume, right, 20 to 40,000 people a day in that age group, you're going to start seeing these cases. You'll have 1 to 2 cases per day. And the Premier is absolutely correct. In young people, TTS is not a trivial condition. It's not trivial in anyone, but in young people, it tends to be more severe, mainly because it manifests up here, all right? Now, the other thing to keep in mind is that we understand that young people are desperate to be vaccinated. They want to do the right thing for all the reasons you elucidated, right? But we would urge calm and we would urge patience, because even if you took the AstraZeneca vaccine today, your next dose, which you do require to deliver that knockout blow to the Delta variant, which is looking like it's going to dominate globally, won't be for another 12 weeks. Realistically, what's going to happen is you're not even going to get it in September. You'll probably get it in mid-October, and mainly because the GPs have a huge backlog of second doses to deliver to patients. The final thing I would say is that based on experience from other jurisdictions, particularly the UK, young people in the age of 30 are only being invited to their vaccine now. That is 7 months into the campaign. They've all had to wait. And they're waiting in a setting that has, had uncontrolled community transmission. What we have in Australia are multiple outbreaks, okay? We do not have surge scenario, and we do not have uncontrolled community transmission. So, we will get these outbreaks under control. We simply must, and it's imperative that the community follows the public health orders in order to do that, okay? Absolutely imperative. So my advice to you is, stay calm, be patient, your turn will come, and that will be sometime in September, and you will be given the Pfizer vaccine, and you will have protection in 3 weeks.
So, but can I just say though, David, Tristan's question was a policy one. He was, if I go and have the vaccine today, when will it bring forward the opening of the borders, or are there targets for opening? If Tristan has his vaccine tomorrow, it will not bring forward the border opening 1 second, let alone 1 day, because we're not going to be able to open the borders until we've got vaccination rates up in the 80%, 75 to 90%, some in that range, and basically bringing forward every person aged 45 or whatever, 35, will not change the border opening timeline.
So I should stress what the ATAGI advice is. This is the Technical Advisory Group on Immunisations. It has made it clear, and in fact the co-chair, Christopher Blythe, Professor Blythe, said today, I do not believe at this stage that young people should be receiving AstraZeneca unless their circumstances are pressed for that. Jason Falinski, let me go to you. Is it still the government's position, as the Prime Minister indicated this week, that if anyone wishes to have AstraZeneca, they're encouraged to go and see their doctor and then they can have access?
That's our position. That's been the position of ATAGI from day one, David.
That anyone, even under 40s, can
even
go
under
and
40. ATAGI from the beginning has made has updated its advice on 3 different occasions. It has said that anyone under the age of 60 who is fully informed can choose to take AstraZeneca if they wish. It's a decision for them. And that, I think, is the advice of ATAGI. And the view of the federal government is that we should follow the advice of the technical...
OK, but to be clear, the co-chair of ATAGI, I just quoted, has said today, I do not believe at this stage that young people should be receiving AstraZeneca unless their circumstances are pressed for that.
We're both saying the same thing, David. So he is saying that if, in his view, people under the age of 60, I assume, should wait to get Pfizer. He's well entitled to that view. But at the same time, ATAGI has said that people making fully informed and consensual decisions when they understand the risk, if they're under 60 and wish to get AstraZeneca, they can do so.
Didn't
that has been the policy of ATAGI from day one.
If Pfizer is not available?
Yeah, it says that the original advice you're talking about, Jason Falinski, says AstraZeneca can be used in adults under 60 for whom Pfizer is not available. The benefits are likely to outweigh the risks for that individual, and the person has made an informed decision based on an understanding of the risks and benefits.
And that's one of the reasons,
Absolutely.
I think, isn't it, that we're all so confused, because this advice, despite what Jason's saying about it not changing, people interpret it differently all the time. And so there's this idea, every premier, every government clings to the idea that there's medical advice and it's a kind of monolithic advice, and it's fact. In fact, it depends a lot on assessment, on interpretation, on judgment, on risk appetite. And so you're going to get kind of different views on this. But I think the public in general are right to feel confused when all the experts are arguing very loudly, whether they're medical, whether they're political, in front of them all the time, and frankly, in a very unhelpful way.
Well, ATAGI also says that ATAGI reinforces the importance of providing clear communication to people who have received or are considering AstraZeneca. I'm not sure if we're getting a lot of that. Jason Falinski, your 50, am I right? 50 years old.
Thanks, David. We've been trying to keep that under wraps for quite some time.
Are you rushing out to get an AstraZeneca jab yourself now?
Yeah, next Tuesday I'll get... Listen, David, I'm not sure anyone should follow my lead. I mean, I'm a Liberal on Q&A with you hosting, so clearly I have a very high risk appetite. But having said that, I'm getting AstraZeneca next Tuesday because my view is that I've looked at the risks, I've looked at the benefits. I think the risks massively outweigh the benefits, and if I can free up a Pfizer dose for someone else who doesn't have my risk appetite, that's fine with me.
Have you sought medical advice though? Have you done what Atagi says?
I have sought medical advice, and before I can get it, I need to speak to a doctor at the GP clinic, which I'll do.
Okay, and then you'll go ahead and get AstraZeneca. Michelle,
I will get AZ next Tuesday.
Is that what someone 50 years old should be doing?
Look, it comes down to risk-benefit discussion, and really all these statistics that get bandied around get distilled and tailored to the individual based on their health, their social circumstances and their economic circumstances. And if they truly do make an
Sorry,
informed...
what's economics got to do with health?
Oh, no, it's very interlinked with health. It's very interlinked with health.
No, sorry, so someone's income determines how the virus works?
No. Absolutely. Where have you been, Jason? I mean, the people,
well,
the people
I've been right
who were
here
most
listening to
severely...
all the advice.
Sorry,
Let's just get an answer to the question you asked.
The people who were most
Michelle.
severely affected all around the world have been the people who are most socio-economically disadvantaged. So, that is a no-brainer, absolutely. So, I think my point is that the discussion around informed consent takes all of those things into account, and that's what doctors do. And I would strongly urge anyone, to go and have this discussion with your GP. Your GPs are waiting, they're doing this every single day, and get your advice from there. And it's an ongoing conversation.
Just to be clear on this point, are you saying that those on lower incomes are more likely to be in service industry work that does have a higher risk in terms of infection? Is that the point you're making there?
Yeah, I mean, I think it's evident throughout the world that people who have been in socio-economic sort of groups on the lower end have been worse affected by COVID.
So there's two elements, David. There's low income is associated with being in one of these jobs which is at higher risk, higher exposure, and secondly, lower income is associated with poorer health status.
Okay, so Jason, you dispute that, do you?
No, I don't dispute that. I think what Michelle is talking about is that people on lower incomes in other parts of the world don't have as good of access to healthcare as they otherwise would. To somehow say that if you're
and they have
on
poorer
lower
outcomes
incomes,
when it comes to COVID.
the virus. Sorry.
Right. Jason, sorry, just finish the point.
I mean, so to somehow turn this into some sort of social justice issue, when in actual fact it's about access to healthcare, not your level of income, I think is wrong.
Let me just go back to Tristan. Has any of this cleared up for you what you should do now?
Actually, yes. Like I was actually seriously considering taking the vaccine because I thought it would bring forward border closures. But thinking about the timelines in the context of the panel and the panel's advice, I'm less confident that that's true now. So maybe I will wait for Pfizer and I will go and talk to my GP if I do consider taking the vaccine. So thank you for I think this has been a clearer debate in this 20 minutes or however long it's been than I've gotten in the past 3 days.
The other point for you, Tristan, is that if you have the AstraZeneca today, you don't have the second dose for another 12 weeks, and you probably have your Pfizer, both doses, before you have your both doses of AstraZeneca.
Well, that is assuming, of course, that we do have the Pfizer
We will come to that.
available.
Lockdowns have proven time and time again to be economical disasters. With an estimated $1 billion lost in economic activity for every week that Melbourne and Sydney have a lockdown, it is simply not a viable solution to keep Australia running. What percentage of Australians would need to have at least one dose of the vaccine to be able to end lockdowns and border closures once and for all?
This is a question that's coming up more and more. Michelle, is there a number?
Yep. So you're really, I guess, alluding to this concept of herd immunity, right? I mean, this is where, pointy elbows up and we sort of push the virus out and we stop it from circulating in the community. We don't know. I mean, that is honestly the $1 million question. We don't know what that number is. Anthony Fauci has said that he thinks that number should be 80%, but it keeps going up, right? 80% or up. And I think that's about right. I think in order to achieve anything close to herd immunity, which is actually proving harder and harder because we're dealing with these highly contagious variants. The Delta variant, for example, can infect 5 to 6 people. And generally speaking, when you have more contagious variants, you need to have much broader, much higher vaccine coverage, okay? It makes sense, right, in order to keep this thing out. So I don't know that we're going to achieve herd immunity with this generation of vaccines, but it's definitely something we could aim for with, the next generation of vaccines as well. The main thing, though, is that we need massive uptake in the population. Virtually, every adult that can be vaccinated should be vaccinated, and we also need to vaccinate children. That is the key. That is the key. We have seen what has happened in other jurisdictions when you don't vaccinate children. There are massive outbreaks in schools, and that's happened in Singapore, it's happened in Israel, it's happened in the US, and hence these jurisdictions are actually now vaccinating children.
And we don't even know when that's going to start in Australia. Yeah, Premier, let me come to you on this. There are various experts with various numbers, but it's difficult. Have you given much thought to what level of vaccination we need to be at to prevent you having to shut down again?
Well, I haven't heard anything out of federal cabinet, and it hasn't been discussed at national cabinet. So I think it's probably time to sit down with the experts and work out what that is. But as I said, we do know that there's more Pfizer coming in the last quarter of the year, and Moderna. So I think we'll see a huge uptake of the vaccination then. I'm quite sure that there will be a very strong communications campaign then as well. But until we get the supply, we don't know what that rate is. But it's about time that some discussions happened around that. Okay. I think people want to know, people want to have a bit more certainty in their life. And like was said, I think it's been very hard in Victoria. I mean, they've had long extended periods of lockdown. We've had short, sharp lockdowns, but I am very concerned about this Delta virus at the moment that's circulating, this Delta strain. It is stretching our quarantine, it's stretching our staff and resources. We're having to broaden the people that are vaccinated. We're looking at now vaccinating fly-in, fly-out workers. We're looking at vaccinating flight crew. I think will be discussed at National Cabinet tomorrow. Then, of course, you've got your aged care workers, your disability workers. Our healthcare workers, they're not mandated at the moment, but we're trying to do that in Queensland. So, look, the more you broaden it, the more Pfizer you need. But the more vaccine you need, indeed. And we just don't have the supply.
On this question, though,
reality.
On this question, though, about where we need to be at to stop lockdowns, isn't the head of your department, along with their state counterparts, working with the head of the Prime Minister's department on this very question? Have you heard anything back from that yet?
Not yet, but I'm quite sure we'll get updated on that. But I do think we need to give the Australian public some sort of ambitious target so we can actually give certainty to the public.
My question is to the Queensland Premier. Next month, you are planning a trip to Tokyo for the Olympics, and even took the Pfizer vaccine over AstraZeneca in order to do so. Scott Morrison travelled to several countries last month and returned to home quarantine. My question to you, Premier, is do you think it is appropriate for politicians like yourself to keep making trips overseas at a time when there is no pathway for Australians to be reunited with their own families? And further to this, Premier, on your return, will you be coming back into the porous hotel quarantine system like every other Australian?
Premier.
Thanks, Lee. Yeah, happy to answer this question, and I might start with the last part of it. I have absolutely said that I will come and do the 14-day mandatory hotel quarantine in Brisbane. I will not be doing home quarantine. Secondly, the reason that I would be going to Tokyo is to actually help secure the Olympics 2032 for Brisbane, Queensland, Australia. This is a very important meeting, and it is expected by the International Olympic Committee that a federal representative, the Premier and the Lord Mayor of Brisbane attend to present in front of the International Olympic Committee. It is envisaged it would be a very short trip, and upon return I would do the 14-day quarantine in a hotel not in my home, not at the lodge.
But Premier, can you understand people seeing the contradiction here? You and your government have been railing against all these people travelling for their business, but you're saying your trip to the Olympics is very important for your job.
Well, it's important for the nation. I mean, this is the 2032 Olympics. It's worth about $14.8 billion. It actually does give people hope and opportunity. And I would hope, definitely by 2032, we would be back to a normal society of freedom of movement. It would create over 100,000 jobs.
But we're talking about the here and now, and your complaints about too many people travelling for business. This isn't something...
I said very clearly that the people who are travelling overseas are unvaccinated. They need to be vaccinated, and when they return, they need to be coming into Australia, they need to be vaccinated.
Will you be fully vaccinated by then?
Yes, I will be.
Okay. Just quickly, on the Olympics, they're only, 3 weeks away. Tokyo had about 714 cases yesterday. Should they be going ahead, Michelle?
The population does not want the Olympics to go ahead. They're virtually begging their government to cease this. This is going to be, the hospitals in Japan are already overflowing. They're under immense stress. The healthcare workers are at breaking point. And now the Olympics are there, and it's going to be a super spreader event. I think everyone accepts that. I've seen a list of some of the mitigations they've put in place. They're just not going to be adequate. So it's kind of scary.
Hello, thank you for joining us tonight. I'm a 20-year-old in my third year at university, and travelling is something that's on my bucket list like most young people. Currently, with the city lockdowns across our nation and the mixed messaging on the AstraZeneca vaccine, how can the federal government expect young people to be patient with the vaccine rollout when we can't even travel to Sydney, let alone the world?
Jason, can you understand Sophie's pain there?
Not being able to travel to Sydney, of course I can understand her pain, David. No one should have to go through that. Sophie, what I can say is I know this is hard. We are in a very difficult moment. We are undertaking, global pandemics come around once every 100 years. We've come up with a vaccine in less than a year. We're trying to roll this out to as many people as possible. I understand that at this point in time we are probably, it is darkest before the dawn, but there is a lot more vaccine coming for the end of the year. Everyone who wants to get vaccinated should be able to have been vaccinated by the end of the year. And at that point, we'll start to see the nation and the country open again. And can I say, I really applaud your spirit of exploration.
Yeah. Well, Michelle, what do you think? Can you understand this frustration that's creeping in? Yes, Australia's done a lot better than the US or Europe over the last year when it comes to dealing with the pandemic. But now, particularly young Australians are starting to get a little frustrated.
Yeah, I completely sympathise. I mean, it's just heartbreaking. We were the envy of the world in 2020, and somehow the wheels have fallen off. And I really, just do not understand how this has happened. That we've ended up being, virtually dead last in the OECD when it comes to second jabs. We are going to get there, all right? I promise we're going to get there. This is the lowest ebb I think we've ever been. I found the last lockdown the hardest, personally, and with my children. And, but the vaccines are there. The vaccines are going to give us hope, and they're going to be, the gateway to our freedom and to our liberation. And they're coming. So we're going to have a couple of months where we're going to be doing it tough. And then September, October, the vaccines will come online, and we really need an almighty uplift, all of nation effort and sleeves rolled up and jabs. Yeah, that's what needs to happen. And I'm confident it can happen. I mean, if the US, right, if the US could administer 100 million vaccines, the plan was 100 million vaccines in 100 days. They hit that target at day 58. They then decided to administer 200 million vaccines. They hit that in day 92. We can do it, all right? We just need to put in place a plan to make that happen, hopefully by Christmas. I like that target.
Yeah, and Jennifer, we've touched on it a bit tonight, this need for a bit of optimism here. We do seem to be at a bit of a low ebb right now in Australia. What would you say to young people like Sophie?
Yeah, well, I certainly hope that 2022 is going to be a lot better than 2021, and I don't think it's good enough to keep harking back to the success of 2020. But in terms of a national effort, I think that's right, but we need to have a very big, positive public relations campaign, which has been really, really badly missing, and I don't understand why.
Stephen?
So I've had 3 holidays cancelled in Australia, 2 in Western Australia and 1 in New South Wales. So I am completely aware of the pain. But the vaccines are increasing. What is missing is national leadership. The National Cabinet has to get together and say, this is the target. When we hit 80%, this is when the borders are going to be opened, and then vaccinated Australians can travel and come back.
Yeah.
And we need to be saying that right now.
And
Premier,
I do think there's been a kind of incredible caution on the part of all governments, but particularly from the Morrison government, after learning that the state premiers were very popular for locking down. They've really stepped back, and I think they need to step forward.
Premier, just finally, final word to you. What are the chances at tomorrow's National Cabinet meeting that you can all get on the same page with the health messaging and with a message of optimism that this vaccine rollout is going to be done by the end of the year, or at least available to all adults by the end of the year?
Well, as long as the federal government secures the supply, I am very hopeful, and I think we should
always blaming someone else.
I said I'm very hopeful that we will actually get to a situation where Australians will be able to travel and meet their family and friends and not have these lockdowns because the vast majority of the population is vaccinated. I know it's frustrating for young people out there at the moment, but can I tell you, I've got 2 frustrated parents that haven't travelled either. So I think the older generation is feeling exactly the same. Everybody wants to see an end to this pandemic. And can I tell you that when we do get in that room, we do actually have the national interest at heart. We really do. And I do love working with my colleagues. And at the end of the day, this vaccine will actually help us see the end of the pandemic.
And that includes the Prime Minister, just finally. You love working with Scott Morrison, Premier?
Oh, he has his moments.
Okay. I think on that note, it's a nice place to finish. And Sophie, thank you very much for that question. That is all we have time for. Would you please thank our panel, Michelle Ananda-Rajah, Stephen Duckett, Jennifer Hewett, Annastacia Palaszczuk and Jason Falinski. And thank you for all of your questions tonight. Next week, we're live here in Melbourne, joined by world-renowned philosopher Peter Singer, Liberal member for Higgins Katie Allen, and journalist and filmmaker Santilla Chinga Ipe. Join us then. Good night.